Institute. Speaking. Most students without much difference, they say that they usually struggle in the listening test. And I somewhat agree. Compared to all the other modules, the most mentally draining module, the module that takes a lot of attention, the module that takes a lot of, you know, concentration is basic the listening test, and so many other factors are involved. Right. So all right, so yes, good evening to Veena as well as okay, grammar class for writing module. All right, let me see what I can do. You can reach out. So Arushi, you can reach out to me anytime you want, no problem. All right, so we had doubts. Okay, so what are we going to discuss in today's session? All right, so in today's session, we are going to be discussing two listening questions, right? Coming from listening part B. All right, so listening part B are basically workplace related conversations. So in today's session, we'll be focusing on two questions that is testing your ability to identify the emotion of the speaker. Okay, so in OET reading listening part B, you will be listening to a conversation. So most of the times there will be, two speakers. Okay, there will be one main speaker and there will be second speaker. And some questions will ask you to identify what is the emotional state of, or, what emotion is being expressed by the speaker over here. Right. So here you have to understand what matters most to the speaker. That is, what is the most important thing to them emotionally or professionally. All right. So your entire focus. So remember when I told you where you focus, okay, that is where you will be improving. Right. So, what are basically speakers' emotional focus questions? Okay, so these are the questions that is basically asking you to identify the emotional focus of the speaker. Right. So, most of the times, the questions will ask you to identify what is the speaker most concerned about. Now, see, concern. Okay, so we have Ramanjit over here. Hi, Ramanjit, good evening. All right, so here, see, emotion, right? Emotion means what? A feeling, okay? Emotions, feelings, we say, right? Now, see, concern, that is what? That is an emotion over here. So here, they are not asking you to understand the English that is being said. They are not basically testing whether you are able to understand the English. Here, they are basically asking you to identify the emotion of the speaker. So, concern. So, there is one particular thing. Concern basically means what? Worry, anxiety, nervousness, panic. Okay, so one particular thing is really concerning the main speaker. So here you have to listen to the audio and you have to identify, okay, what is the one thing that is concerning this person, and there is a strategy for it. Right. Next, these questions will ask you to identify how the speaker feels or reacts. All right. Now, say, what is the difference between response and reaction? Response and reaction. Response basically means what? For example, let's say someone is speaking with me in a very angry tone. Someone is speaking with me in a very angry tone, and I am listening to that person. I'm pausing my mind and with thinking, okay, I'm actually thinking about my reply, and then I'm actually saying back. That is what we call as a response. Right, someone is talking to me angrily, I am not behaving angrily like that. I'm actually being able to stay calm. I'm able to think very clearly, and with some clarity I'm replying back. That is what we call as a response. What is reaction? Reaction is impulsive. Right, reaction over here is impulsive, which means there is actually no thought, there is no filter. Okay, someone is reacting to me angrily and impulsively without any thinking, I am replying back. That is what we call as a reaction. So reaction is always going to be emotional. Okay, so that is one small word. Okay, and most of the questions that I come across in listening, they ask you, how did the patient react? How did the main speaker react when they discovered so and so? That is, when they discovered one particular information, immediately, impulsively, how did they respond? Okay, that is what we call as reaction. So as you can see over here, reaction, that is also an emotion. Okay, because only an emotional person will react. Okay, so these type of questions will be asking you to identify that as well. Next, these questions will ask you, what is the speaker's priority or emotional tone? Now, see, there are different types of, emotions. If, for example, we have happiness, okay, we have concern, right? We have frustration, we have doubt, okay, we have nervousness. Okay, so these are common emotions that we can, or we can say optimism means what? A patient is feeling positive, hope, right? See, these are all different types of emotions. So when a person is happy, they will be speaking in a tone which reflects a happy tone, right? When a person is frustrated, they will speak in a frustrated tone. That is, the language may be the same, the English may be the same, but the style in which they speak, okay, the method in which they speak, the tone in which they speak will actually reflect the feeling or the emotion that the main speaker is having. Right. So these questions will ask you to identify what is the emotional tone of that particular person. Okay, and it is not about understanding the English. It is about understanding how they are saying that English. Right. So that is what we'll be discussing in two questions, or that we'll be discussing today. Now, as a teacher over here, my duty is to give you the right strategies for OET success. So I want all of my students to succeed, right? So these are the strategies that I can give for questions that is little bit centered regarding emotional tones. So when you read a question, first and foremost, you must read the question and you must be able to understand that this is a question that is asking you to identify the emotion of the speaker, right? So if you once if, first of all, if you identify, okay, this belongs to this question category, then you have to train yourself, you have to prepare yourself, you have to mentally prepare yourself to listen for emotional language when you're listening to the audio. That is, see, they give you 15 seconds time. Okay, so we're dealing with part B questions, right? So how many questions are there in part B? There are 6 questions in part B. Now for each question, the OET is giving you 15 seconds time. Now, why are they giving you this 15 seconds time? They're giving you this 15 seconds time to identify the question type, right? They are giving you time to identify the question type and also to mentally prepare yourself. This is the reason why they're giving you 15 seconds time to read the question, right? And then they'll give you the audio and they will play you the audio for 30 seconds. After 30 seconds, the audio will be done and they will give you 5 seconds time to mark the right answer. Right. So this is the format of the listening part B. All right. So over here, first and foremost, you have to identify the question type. Okay. This is a speaker's emotional tone identification question. Then you have to mentally prepare yourself. That means you have to tell to yourself, okay, when I'm listening to this particular audio, I must not give importance to facts. I must not give importance to what is being said, but I must give importance to how they are saying that information, right? So listen to words that expresses emotions, like say worried, mind boggling. So these are words that expresses emotions. These are what we call as emotive words that shows emotional focus. This is how you have to train yourself. You have to pay attention to tone and emphasis, right? See, for example, just by listening to the tone of the speaker, not the English. Okay, the speaker will not say, I am feeling very calm, I am feeling very surprised, I am feeling very frustrated. The speaker will not say this. Okay, I am frustrated, I am surprised. The speaker will never say that. But you have to decode it. You have to say, okay, the speaker is calm, the speaker is surprised, the speaker is frustrated, by listening to the tone of the person, right? So that is where you have to practice. That is the right methodology when it comes to these type of questions. Now again, these OET people, okay, these Western folks, they are very, very cunning. Okay, they are not straightforward. They really like to mislead you, they like to distract you, they like to misguide you. Okay, so we should actually not fall into those traps. So there are so many traps, right? So listening, reading, writing, speaking. Okay, those you all know that the OET always likes to play mind tricks. Okay, so our mind plays a lot of tricks on us, and they are going to amplify that. So when it comes to emotional type questions, you have to ignore, superficial information. Okay, that is, just because something is mentioned doesn't mean it is a speaker's priority. Okay, so they will. So there are three answer options in total, right? Only one answer option is correct, which means two answer options are incorrect. Now, what these people will do is they will repeat the same words in the wrong answer options in the audio. Okay, now what a student does is, now the student will feel, hey, they have repeated the same word, they have repeated the same sentence in this answer option and the audio, so that means it must be the right answer. That is not how emotional focus type questions works. Okay, so here, just because it is mentioned, it does not mean that it is the speaker's priority. You really have to listen very carefully and then make the right connection. Now, what type of questions are we dealing with? We are dealing with multiple choice questions. So actually we are very lucky, because compared to other language exams, that is IELTS, TOEFL, PTE, GRE, Duolingo, etc. There's so many other language proficiency tests where you have to write, you have to listen, then you have to write different types of questions, but here everything is multiple choice questions. So the OET has done their level best to make it as simple for you, but still there's a little bit of trickery. So since we are dealing with multiple choice questions, and if it is a difficult question, you should refine your elimination strategy. That is, instead of always trying to find the correct answer, you try to eliminate the incorrect answer options, right? So here, since everything is emotionally emphasized, okay, so the right answer option is emotionally charged, right? So what you need to do is, even though the exact words may be mentioned, the answer options, the exact words will be mentioned in the audio, but if it is not emotionally charged, and if they are just factual, okay, they are factual but not emotionally emphasized, then you can basically eliminate the incorrect answer options one by one. Right, so I'll be training you. Okay, so this is why we have the 24/7 available recorded lectures from the OET Exam Mastery app. So you can always access those lectures and prepare yourself accordingly. Right, so let's come to a small recap of today's agenda. So we are just going to begin the session. So today's session will focus on two questions. Both the questions will focus on the main speaker's emotion. Right, so I'm giving a clue over here. So when I'm going to give you the time to read the questions, and when I'm going to play the audio, you have to listen not to the facts, but you have to listen how they are saying that information, so that you're able to pinpoint the feelings, the tone, the attitude and emotions of the speaker. Right, all right, so the first question that I want you all to do is this particular question. Right, so I'll give you some time to read this question. So this is the 27th question. So first I want all of you to do it on your own. Right, then I will play you the audio, and you need to type your answer in the chat box. So in the chat box you just type down your answer, and once that has been done, I will give you the strategic insight. Okay, so everyone, read the 27th question and prepare yourself for the audio. Okay, so now I'm going to play the audio. Listen very carefully.
It looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Will she be going up to the ward soon?
Yes, I'm going to call a porter. She should be going up in 15 minutes.
Okay. I've added some extra post-op pathology orders. She may have problems with the drop in her calcium. Her thyroid was just huge. We didn't see all four parathyroid glands, and we need to check that they haven't been affected by the procedure. She seems okay, but I want her calcium level checked twice a day. She needs to be monitored for any breathing problems, muscle cramping and numbness, and for tingling in her fingers.
Okay, I'll make sure a report to watch out for hypocalcemia is passed on.
Okay, if you need me, call me.
All right. So I'll play the audio once more. All right. So because this is a slightly the audio is a little bit fast paced, right? And then I'll go back to this thing.
It looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Will she be going up to the ward soon?
Yes, I'm going to call a porter. She should be going up in 15 minutes.
Okay. I've added some extra post-op pathology orders. She may have problems with the drop in her calcium. Her thyroid was just huge. We didn't see all 4 parathyroid glands, and we need to check that they haven't been affected by the procedure. She seems okay, but I want her calcium level checked twice a day. She needs to be monitored for any breathing problems, muscle cramping and numbness, and for tingling in her fingers.
Okay, I'll make sure a report to watch out for hypocalcemia is passed on.
Okay, if you need me, call me.
All right. So that was the audio. So what's the answer? Type your answer in the chat box. Is it answer option A, answer option B, or answer option C? All right. Okay, so it's good, impressive. All right, so everyone has participated. Now, when we are dealing with multiple choice questions, right, especially when it comes to, part B and all, we always need to understand that there are certain things we need to keep in mind. There are 3 steps, right? So my previous students must be knowing what those steps are. So step number 1 is what? Step number 1 is what we call as comprehension. Okay, so I like to repeat this information multiple times. Comprehension. Then comes step number 2, which is basically what? Retention, right? And step number 3 is what? Is detection. Right. These are the 3 universal steps that needs to be applied to every single multiple choice question. Right. So step number 1, comprehension, right? So why is comprehension very, very important? This is done to identify the question stem, right? So every question, okay, every question will have one focal point. Okay, one focal point, or your duty over here. Okay, I like to use that word. So you really need to identify what is the stem of the question, because that will give you that laser sharp focus, right? Now there is one method in which you have to comprehend the question. So what is that method? That method is what we call as keyword analyzing, keyword analysis, right? So you have to first and foremost be able to identify the keywords, and then you have to link those keywords together, and you have to register this information to your mind. Okay, so this is what we call as comprehension, that is understanding what your duty is. Now, what is step number 2? Step number 2 is retention. Retention basically means you have to register the memory of this question to your mind. That is, you must not forget what you understood. So whatever you have understood, you must be able to register that into your mind, right? And then with that memory, you have to go and you have to listen very attentively. So you have laser sharp focus. You know exactly what your duty is. Okay, I'm here to understand what is the concern of this person, and then you have to detect the right answer. Right. So here, okay, so when it comes to detection, you really have to be very good in elimination strategy as well. Okay. So sometimes choosing the right answer is not always, possible. Okay. So choosing the right answer is slightly tough. So what you can do over here is you can refine your elimination strategy. Okay. That is how you have to detect the right answer. Now, let's do step number 1, that is comprehension of this question. So for that, we will be doing the keyword analysis, right? So let's take a look into the question. The question over here is, you hear a surgeon discussing, 1 second. Yeah, all right. All right, so this is the question over here. Yeah. Mm, yes. All right. So you hear a surgeon discussing a patient with a nurse in the recovery ward. Now see, where is the location over here? The location is the recovery ward. Recovery ward basically means what? Where patients usually are, they're recovering. That is, after a major operation, they're recovering. So we understand that a operation has been over, has been completed for a patient, and now the patient is in the recovery ward. Now this conversation is happening between a surgeon and a nurse, and they're discussing about a patient who is in the recovery ward. Right. Now, what is the stem of the question? They are not asking you what surgery was given to the question to the patient over here. They are not asking you what medications were given. They are not asking you what the medical test of the patient is. They are asking here that even after the surgery is over, even after the surgery is over, when the patient is inside the recovery ward, the surgeon is still concerned about one particular thing. So concern is a feeling. Okay, it is an emotion over here. So what is that one particular thing that is really bothering the surgeon, right? That is, he is right. So let's see what is the surgeon concerned about. Right, now we have three answer options: answer option A, answer option B, and answer option C. So what is answer option A? Incomplete results from lab test. So here the results over here, okay, the results from the labs, they have been incomplete. Okay, and that is the reason why he is concerned over here. Now what is answer option B? Answer option B is possible post-operative side effects. Okay, so there are certain side effects over here that may or may not happen. Okay, and that is the reason why he is concerned. Now, what is answer option C? The patient's level of consciousness. Okay, the level means the degree. Okay, to what extent, to what degree the patient is conscious. Consciousness basically more unconscious, subconscious, whatever it is, right? So these are the three things that the surgeon is really concerned about. Now, remember when I talked to you about the elimination strategy, it is the importance of elimination. Now, there is one small trick that I can give you over here, right? So that trick is what we call as the verb analysis, right? So this is not always 100% effective, but I would say it is effective, 80% of the time. Okay, 80% of the time it is really, really effective. Verb analysis. So those who are a little bit new, what do we term as a verb? Action words, right? Any kind of an action, any kind of a movement is what we call as a verb over here. And when it comes to elimination, this verb analysis is extremely helpful. The more you practice this verb analysis, the more you refine it on your examination day, the more accurate your answers will be. Right, now let's see what are the verbs, okay, that we can get from each of the answer options. So over here, incomplete results from the lab test. So what is the action over here? So we have received results from the lab, but how did we receive the results? The results are basically incomplete. There is no completion. It lacks an completion over there, right? So this is the fundamental thing that this person could be concerned about: incomplete results from the lab. Okay, so they gave some orders to the lab, but the chart is basically incomplete, and that is really bothering the surgeon. Now, what is the verb or action in answer option B? Possible post-operative side effects, right? So effect over here, okay, that is one action over here, right? Post-operative side effects, this is something that the patient will actually experience. So over here, this is the keyword over here. So this person over here is really concerned about the side effects of the operation. Post basically means after, and possible basically means what? There is a chance, okay, there is a chance that the patient may experience side effects after the operation, and that is the one thing that the surgeon is really concerned about. Now, what is the verb in answer option C? What is the word that is closest to the action over here? Consciousness. Okay, so being conscious, that is a, that is a, being, that is a state. Okay, so over here, the patient's level of consciousness. Okay, so the patient is not too conscious during the recovery ward. So maybe that is the reason why he is concerned about. Right. So again, the verb analysis may be tricky, especially those who are in the beginning. But identify that, I understand that when it comes to every single answer option, there is one particular word. Okay, so just like this is the stem of the question. Okay, so what is the stem of the question over here? The concern of the surgeon, right? And the stem over here is the focal point of the question. right? So this is the focal point of the question, right? And similarly, when it comes to the answer options, over here, the verbs, okay, or the verbs or the verbs or the words that is closely related to the verbs over here, these will be usually the focal point, okay, the focal point of the answer options. Right, so that is the reason why this is little bit important, and this is extremely helpful when we're dealing with elimination strategy. Now, what we just did, okay, is we have just completed step number one. And what is step number one? Comprehension, right? So what we just did is we have just completed step number one, that is comprehension. So we have done the keyword analysis, right? So when you're doing this on your examination day, you should have your pencil with you, you should have your printed question paper with you, and you must be able to underline the important words. I am hearing a surgeon talking with a nurse in the recovery ward with a patient. My duty over here is to identify the emotion over here. That is one particular thing that is the person is really concerned about. Okay, so that is my focal point over here. That is the stem over here. And when it comes to the answer options, incomplete results, side effects, level of consciousness. So like this, you have to register this information to your mind. So that is step number two, right? Step number two is what we call as retention. So once you have understood everything, again, see, in the beginning phases, it may take some time, but slowly, gradually, it becomes manageable. Okay, so it just takes some time to equip all these strategies very quickly. So now you have to retain this information to your memory, right? Now, very importantly, what you need to do is when the audio starts to play, right? So now the OET people, they are going to play you the audio, right? Now, what should you do when the audio is going to play? Your eyesight should only be in the answer options. That means you must have the memory of the question. Okay, what is the concern of the surgeon? Okay, so that memory you should have. This conversation is happening in the recovery ward between a surgeon and a nurse. The discussion is about a patient, concern of the surgeon. So that memory should be there. You must not forget it. But now when you're listening to the audio, your eyesight should only be in the answer options A, B, or C. Because let me tell you one thing, when the audio is playing, at that time, if you're reading the question, you are going to distract yourself, and you may really miss out on the right answer, because even 1 to 2 seconds of focus, if we lose, it will have consequences. Right. So we have discussed comprehension, we have discussed retention. Now you have to go and detect what the right answer is. Right. So we have listened, so I played the audio twice over here. So now what I'm going to do is I'm going to take the audio script. Okay, I'm going to take the audio script so that the teaching becomes a little bit more effective. And I'm going to train you how your eyesight should move from one answer option to other option, and how you should be able to eliminate the incorrect answer options one by one. And finally choose the right answer option without any doubt. Right. So let's take the transcript over here. Right, so this is the transcript. So we listen to the audio twice over here, right? Now let's take a look into what the audio transcript is telling us. Right, so here the transcript is this one. So the surgeon over here. So this we have two speakers over here. Is this 27? Yeah. All right. So there are basically two speakers over here. You need to understand. So I'm going to give you a very important information. So there is one main speaker. Okay, the main speaker over here is the surgeon, right? And then we have the second speaker. The second speaker is the nurse over here, right? The second speaker is the nurse. Now you see, even though for us the main speaker is the important person, right? So for us the nurse, the second speaker is not that important. For us only the main speaker, because that is the person who is concerned, that person's emotion is what we really need to identify. But the second speaker over here, they also play a small role. Okay, so these person actually okay, trigger the main response we are looking for, or we can say they shape the answer. Okay, the second person over here, the second speaker over here, they will basically ask the right questions. Okay, they will navigate the conversation such that we get the main answer from the surgeon, right? So again, just you need to understand that even though the main speaker, the second speaker is not that important in some questions, they also have a tiny role because the answer is being shaped by the second speaker's response. Right. So let's see what the main speaker over here is saying. Right. So in the audio was a little bit fast. When I played the audio, okay, it was a slightly advanced level question. The audio went a little bit fast. Now, anyway, let's take a look into the questions over here, right? So they give you 15 seconds time. So within 15 seconds, you have to read the question. Surgeon talking about a patient with a nurse. Okay, recovery ward. My duty is to find the surgeon's concern. Surgeon's concern. That is what I need to identify. The concern could be incomplete results. It could be post-operative side effects. It could be patient's level of consciousness. So like this, within 15 seconds, you have to try your level best to register all this information to your mind, right? Now, when you're listening to the audio, your eyesight should only be in the answer options and they will cover A, B as well as C. Right. Now let's take a look into the transcript over here. Now, the main speaker over here is saying, it looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Will she be going up to the ward soon? Right? All right. So over here, it looks like Mrs. Jones is still a bit groggy. So still over here. Okay. Still is basically means what? Present tense. Okay. So over here, the patient's level of consciousness. That means currently, presently, the patient's level of consciousness is what is concerning the person over here. Now see in the very beginning. So this is why I told you when you're listening to the audio, if you're reading the question, you may really miss out on the answers over here. Now, in the first sentence, that is the very first few seconds itself, they're directly coming to the patient's level of consciousness. See, what's the main speaker saying? It looks like Mrs. Jones is still a bit groggy. Now, what is the meaning of groggy over here? What is the meaning of groggy over here? It means, drowsy. Okay, the person is a little bit drowsy, the person is not fully aware. Okay, the person is not fully alert over there, so a bit groggy. So that means they are talking about what? They're talking about the patient's level of consciousness. So your eyesight, so remember when I told you, you have to retain all this information into your memory within the first 15 seconds, right? And when you're listening to the audio, your eyesight should only be in the answer options. So they are talking about, the main speaker is beginning with, okay, after thyroidectomy, the patient is currently feeling a little bit groggy. Okay, so that's a little bit of an advanced vocabulary. So you must be able to relate. Okay, they're talking about the patient's level of consciousness. So over here, answer option C is where your eyesight should be. Okay, your eyesight should be in answer option C, not the questions, not answer option A or answer option B. And now you have to wait. You have to confirm whether they are going to, whether the speaker over, the main speaker, that is the surgeon over here, is really concerned about her grogginess. Okay, so groggy is stated, that is level of consciousness stated over here. But now, even though it is stated, even though it has been mentioned, we have to determine whether this is the one thing that is concerning the surgeon, right? So let's see, let's wait and let's find out whether grogginess is really upsetting this person. So here they're saying it looks like Miss Jones is a little bit groggy after her thyroidectomy. So this was the operation that was completed. Now the person is asking, will she be going to the ward soon? That is, will she be going to the recovery ward? Now the other person, the second speaker over here is replying, yes, I'm going to call a porter. That is a person who shifts patients from one department to another department. She should be going up in 15 minutes. So yeah, so she should be going up in 15 minutes. Now, what does the main speaker say over here? Okay, right? So main speaker is saying okay. Now see over here, what is the emotion? So the person over here is asking, is saying about her patient's level of consciousness, that is grogginess, and he is not expressing any kind of a concern. Now say, do you see any kind of a concern that is being expressed over here? Okay, is she going up to the ward soon? Okay, otherwise, see, the patient is really concerned. The speaker is mainly concerned. What will they say? Oh, the person is really groggy, and I really wonder why. This is very much abnormal. It should not happen. So, if they're saying like that, then we can say that the person is concerned about the patient's grogginess. But over here, no concern, no emotions, a very casual response over here. Okay, her operation is over. will she be going up to the ward? So the other person is saying, yes, she'll be going up in 15 minutes. And the person is saying, okay, right? So what can we do? So we can say that answer option C, even though they have covered answer option C, that is level of consciousness, it is not at all a thing that is concerning the surgeon over here, right? So you can say that it could not be the right answer. So we can almost, like, mentally we can actually eliminate the answer option C, or let's just keep there. Okay, otherwise if you want to be a little bit more particular, you can just understand, okay, consciousness, grogginess is mentioned, but I'm not getting the concerned emotion from the surgeon over here. Right. Now let's see what the speaker is saying, the main speaker. Now the person is saying, I have added some extra post-op pathology orders. Okay, so now he is saying, now your eyesight. Now see, post-operative pathology orders. So that means what? Laboratory test, pathology, laboratory test, right? So now your eyesight should go from answer option C to answer option A, right? Because now they're talking about lab test. See, this is how your eyesight should work when you're dealing with multiple choice questions of OET listening, right? So from C, now you're going to B, right? So what is the answer option A over here? A is telling incomplete results from the lab test, which means they place some orders. Now see, incomplete results. That means it is basically past tense. That is, they gave some laboratory orders and they received the results, but everything is incomplete. And that is the one thing that is concerning this person. So anyway, now your eyesight from answer option C has gone to answer option A. The person is saying, let's see what the person is saying. The person is saying, I have added some extra post-operative pathology orders. She may have problems with a drop in her calcium. Okay, now this is what? This is basically, what's the tense over here? The tense over here is future tense. Right, future tense, not exactly future tense over here. Now see, I have added some extra post-operative pathology orders, which means this action has been done recently and now they have to wait. They have to wait for the laboratory to actually give the results. So these orders, immediately they will not be getting the orders, right? See, I have added some extra post-operative pathology orders, right? So now they have to wait. Okay, now when this conversation is happening, they have not received anything. They have not received any kind of laboratory test in their hand. Now they have to wait in the future. Okay, that is, the order must go to the laboratory test. They have to do the test over there, and then only they will receive the results from the lab, which is basically future oriented, right? So again, I'm just giving you some extra information for that much thoroughness over here, right? Now see, now he is giving an explanation. Now he is giving a reason why this laboratory test was ordered. So he is saying over here, she may have problems with a drop in her calcium. So her calcium level has dropped and she is having some issues with that. Her thyroid was just huge. Okay, so it's a thyroidectomy. So here the thyroid was just huge. We did not see all four parathyroid glands, and we need to check that they haven't been affected by the procedure. Right. Now see over here, what is now this is all distracting information. So remember when I told you that the OET will always try to distract you. That is, they will always bring an information that to misguide you and mislead you over here. Now see this entire section. Okay, she may have okay, now see this entire information. She may have problems with a drop in her calcium. Her thyroid was just huge. We did not see all four parathyroid glands, and we need to check that they haven't been affected by the procedure. Now see all this information. Now, did we read any, so from the answer options, right? From the answer options, did we read anything about a drop in her calcium? Did we read anything about her thyroid being huge? Did we read about anything about four parathyroid glands and that they were not able to, see all those kind of things, right? So it was basically not mentioned over there. So again, just giving you a small hint over here. This is how the OET will bring in some extra information to distract you, right? So that's a distractor over here. So you must be able to, not give that too much importance over here, right? Now anyway, let's keep reading the audio script over here. Now the person is saying, she seems okay. Now see, what is the emotion you get over here? Okay, she seems okay. Now see, her thyroid was huge. So all these things, okay, a drop in her calcium, her thyroid was just completely huge. Okay, we did not see, they were not able to see the four parathyroid glands. Okay, and all these things, all these concerns, they are saying drop in our calcium, huge thyroid, and parathyroid. So these are all concerning things over here. But what is the speaker saying? The speaker is saying she seems okay. Okay, the speaker is saying she seems okay. So regarding all these things, even though they're distracting information, there is no feeling of concern. There is no emotion of concern that the person is expressing. Right? But over here, now the answer is going to come. Now see, she seems okay, but this is one very, very important word in OET. But I want her calcium level checked twice a day. Now the person is saying, I want her calcium levels checked twice a day. She needs to be monitored for any breathing problems, muscle cramping, numbness, and for tingling in her fingers. Right. Now okay, so how about we just identify what these things are? Okay, so the person is saying, I she seems okay, but I want her calcium levels checked twice a day. Okay, so we need to check her calcium levels twice, and he's saying over here she needs to be monitored. Okay, she needs to be monitored for any breathing problems, muscle cramping, numbness, and tingling in her fingers over here. So what are all these things? Breathing problems, muscle crampings, numbness, and tinglings in her fingers over here. She needs to be monitored. So these are all what possible side effects that can happen. Okay, muscle problems. So what are they talking about? Now they're talking about answer option B. Right now, what is so now your eyesight should come to answer option B. So from answer option A, you should come to answer option B, because all the side effects, breathing problem, cramps, okay, calcium level being checked 2 times and all that, so the side effects are being talked about over here. Right now, before they talked about the side effects, the person is saying she needs to be monitored. So when will we say you need to monitor this? You need to observe this. You need to pay close attention to this when the person is concerned, right? So the surgeon over here is really concerned that she may develop these kind of post-operative side effects, which may include breathing problems, muscle crampings, numbness, tingling, and sensations in her fingers over here. Right now, so B could be the right answer, but however, okay, to be little bit more thorough, the main clue over here. So the OET will always give you some clues. So before they actually bring in the right answer, before the OET actually brings in the right answer, they'll give you one clue over here. Now this is the clue, the biggest clue. So the biggest clue in this entire audio script is this one tiny word, which is called as but. You know what this but is called? But is called as a contrast marker. So you really need to be thorough. Again, this is extremely important in reading part as well. Reading part B, reading part C also, contrast markers are extremely important. Now I'll just give you some important words, common words that comes under the category of contrast markers. So the most common, the highly widely repeated contrast marker is but, and then we have although, however, on the other hand, despite that. Okay, so these kind of words, okay, so these kind of words, what do they do? Okay, they actually signal. Okay, so what is a contrast marker? Contrast markers, so those who are relatively new over here, contrast markers are words. Okay, so these are words that signal a sudden shift in tone or idea. Okay, so when the speaker over here, okay, when the speaker or the writer, okay, doesn't matter whether doing listening or reading, when the writer or when the speaker, when they want to suddenly change the tone, when they want to suddenly change the idea, that is from positive to negative, okay, or from negative to positive over here, that is from positive to negative, or from negative to positive, right? See, positive information and then suddenly a negative information and then negative information suddenly to a positive information. They and without using a full stop, they always will be using a contrast marker. Okay, so contrast basically means what? Opposite. So green and red, they are contrasting colors. White and black, they're contrasting colors, right? So especially now, this is one really important thing I wanted to say. When you're dealing with, tone, attitude, or emotion types questions, you really have to give importance to contrast markers, because contrast markers will basically reveal the emotion. Now see over here, she seems okay. Now see, when the writer over here, when the speaker over here is saying she seems okay, what is the feeling the person is having? Casual. Okay, the person is not concerned, she seems okay. She seems okay over here means the feeling over here is that person over here is not concerned, right? Now from not concerned, sudden change. Okay, from not concerned, what is happening over here? A sudden change is happening. Okay, and that word over here is this word called but. Okay, so she seems okay. Okay, the person's feeling over here is completely unconcerned. Now they're using the word but over here. Now the word but is coming over here, so that means it is a contrast marker. So not concerned becomes concerned. Not concerned, again contrasting information, right? The opposite is going to come. So that though this word over here is signaling that change in the emotion. Now the person is saying, I want her calcium levels checked twice a day. So the person is saying indirectly, okay, this is always indirect. These are not direct over here. The person is indirectly saying, I'm really concerned about her calcium levels. I'm really concerned about her breathing, that she may develop breathing problems. I'm really concerned that she may have muscle crampings. I'm really concerned that she may develop numbness. I'm really concerned that she may develop tingling sensation. I don't think she's going to be okay. So therefore, since I'm very much concerned, I want you to monitor her continuously. I want you to observe her closely, right? So when it comes to these type of questions, okay, even though the message over here may be indirect, and maybe the emotion the person expresses may be indirect, the clue over here, the biggest clue when it comes to these type of questions are always going to be contrast markers. And these are the common contrast markers, although, however, on the other hand, despite, but the most common is this particular word, the word but over here, right? And now the other speaker, the other, what is the other speaker saying? The other speaker is saying, okay, I'll make sure to report to watch out for hypocalcemia is passed on. If you need me, call me and all that. Right. So we can say that answer option B is indeed the right answer. Right. Now see, our eyesight, okay, our eyesight went from answer option C, then it went to answer option A, and then it went to answer option B. Now you must be able to, just because everyone, I'm very impressed, I'm very happy that most of you have written the answer as B as the right answer over there. But along with that, you must also have the ability to say why A is wrong and why C is wrong. That is even more important. Okay, sometimes choosing the right answer is really good. Okay, I'm very happy to hear that. But at the same time, a thorough student will be able to explain why the other two answer options are wrong. Now, see, why is answer option C wrong over here? The patient's level of consciousness. So that is the first thing the person is saying, right? In the very first 2 seconds, the first 2 seconds itself, the person is saying over here that the patient's level of consciousness, that is, she is feeling very groggy. But what is the emotion over here? There is no concern that is being expressed over here. A very casual response. The person is saying, okay, okay, no problem. So we can say, no, yes, the concern is basically mentioned over here, but that is not at all something that is worrying the surgeon. So we can say that answer option C is not going to be the right answer. You can eliminate answer option C, right? Now, what is answer option A? Incomplete results from lab. So first of all, this is not at all mentioned. Is it mentioned that that they received? Is it mentioned that they received lab test and the lab tests were incomplete and that is concerning the person? It is not at all mentioned. The incomplete results is not mentioned, but laboratory test is mentioned. How is it mentioned? They are using synonyms there. That is, pathology orders, right? But this is past tense. So here you really have to bring the tense over here. So here they're describing answer option A as an event that already happened. That is, they already received the results from the lab, and after they checked it, it was incomplete. So here they are revealing it as a past incident over here. But when it comes to the audio, when it comes to the audio script over here, what is the tense? It is future tense. So saying I'm going to order, I have added some operative pathology reports and I'm waiting for the results. Here the person is saying I have just ordered and I'm basically waiting for the results from the laboratory. So that they are talking about an event that is going to happen in the future, right? So here it is past tense, but in the audio it is future tense. So there is a mismatch of tense over there. So what will we do? We will eliminate answer option A. So if you eliminate answer option C and if you eliminate answer option A, then by default, what is the right answer? The right answer automatically becomes answer option B. Now, see, this is the beauty of elimination strategy. Sometimes, even without even hearing the right answer itself, you can say that this is the right answer. Now, what is answer option B? Possible post-operative side effects. Okay, so side effects over here. Is it mentioned over here? It is completely mentioned, right? So this entire portion over here, breathing problems, muscle crampings and all, and she needs to be monitored. And how the concern is coming over here? Using just one tiny word, that is this word but, which is a contrast marker. And contrast marker, what does it do? It signals a sudden change in the tone over here. So here it's a very casual tone, it is a non-concerning tone. Now immediately they are using a contrast marker, which basically means the exact opposite is going to come, and that is a concern over here. So this is the one thing the surgeon is concerned about. So see how brilliant the OET is. So this is the reason why we have to stick with the official OET materials, and you really have to expose yourself to these type of questions repeatedly, and that thoroughness you have to develop, right? So what I'm going to do is I'm going to play the audio once again, and then we'll go to the next speaker's emotion type question. So all these questions over here in very detailed classes I have already explained, okay, in the recorded lectures. So all you have to do is just open the app and see what those recorded lectures say. And here I'm just giving you the strategic insight. So going to play the audio now. Here the audio script.
It looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Will she be going up to the ward soon?
Yes, I'm going to call a porter. She should be going up in 15 minutes.
Okay. I've added some extra post-op pathology orders. She may have problems with the drop in her calcium. Her thyroid was just huge. We didn't see all four parathyroid glands, and we need to check that they haven't been affected by the procedure. She seems okay, but I want her calcium level checked twice a day. She needs to be monitored for any breathing problems, muscle cramping and numbness, and for tingling in her fingers.
Okay, I'll make sure a report to watch out for hypocalcemia is passed on.
Okay, if you need me, call me.
Right? All right. So that's a slightly advanced level question. I would not say it is extremely difficult, but I would say it is slightly above medium difficulty question, because especially the audio is a little bit fast and the accent may be slightly tough as well. Again, it is not going to be very easy to get 42 out of 42. Deliberately, the OET will make few questions extremely tough, right? All right. Now let's go to the next question. So this also over here is a similar question over here. So this is the 30th question, right? So read the 30th question and I will play you the audio. 1 second. Again, so in the recorded lectures, all the information has been given through very detailed lectures are all at your disposal, and only my students have this access. So if you're not utilizing this, I don't know what to say. All right, so let's come to the 30th question. Is this the 30th question? Sorry, no, this one. All right. All right, so read the 30th question. Okay. Audio script.
How are you feeling, Mr. Shaw?
Exhausted, but the painkillers must be working. I can't feel my knee as you predicted.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month.
Good.
Give it 4 months before you put any serious impact on it, though.
4 months. After my last stop, I started running again within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
All right. So, okay. So what is the answer? Is it A, B, or C? I'll play the audio once again. Doesn't matter if your answer goes wrong. This also is a slightly challenging question. I'm not saying it is difficult, but I'm going to say it is challenging. What's the answer? All right, I'll do one thing. I'll play the audio once again, right? Let's hear the audio script.
How are you feeling, Mr. Shaw?
Exhausted, but the painkillers must be working. I can't feel my knee as you predicted.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month.
Good.
Give it 4 months before you put any serious impact on it, though.
4 months. After my last stop, I started running again within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
All right. So, in simple. Now, what's the answer? Is it A, B, or C? Okay. All right. So let's begin with the discussion. So what are the 3 steps? Okay. Step number 1, comprehension. Step number 2, retention of the question. Step number 3 comes detection, right? So for comprehension, what are we going to do? We are going to identify the question stem, right? You have to identify the question stem, and this is done using the keyword analysis, right? Now, what is retention over here? It is registering that information to your memory. You must not forget what you have understood. And then comes detection, right? So detection over here basically means you have to bring in your elimination strategy, and this elimination strategy is usually perfected using the verb analysis, right? So it may take some time for you to get really familiar with the verb analysis, but if you really, refine that skill, it is going to be very good for you. All right. Now let's take a look. Yes, yes, very good, Arushi, the 3 steps. All right, now let's take a look into the 30th question, right? 30th question is this. You hear a surgeon. So whose voice are we hearing? Okay, the main speaker over here could be the surgeon. So anyway, you hear a surgeon talking to a patient who just had a knee operation just over here. Okay, so see, you may actually overlook these kind of words. What does the word just mean? Just basically means what? Recently, very recently. Okay, just recently, right? So very recently the patient had a knee operation. Okay, and we are hearing a patient consultation. A surgeon is having a conversation with the patient over here. Yeah, currently, yeah, recently. Very good. Right now, what is your duty here? Okay, your duty over here is to identify from the comments. Comments basically means the dialogues. Okay, from the dialogue of the patient. Okay, from the dialogue of the patient over here, what emotions is being revealed? Okay, what emotion is being revealed? Yeah, what patient said, right? Along with that, you have they are not ask they are asking you, the patient is saying something, but what emotion is being revealed? Okay, what feelings is being revealed by the dialogues of the person? That is the most important thing. Okay, so is the person revealing that he is feeling impressed, whether he is feeling surprised, whether he is feeling determined, so and so. Okay, so what information, what idea do we get from the person's way of speaking? Right. Now, let's take a look into the answer options over here. Okay, so what is answer option A? Answer option A is this. He is determined. So he over here, he is basically determined to start doing sports as quickly as possible. So over here, he is determined. So what is the emotion over here? Determined, okay? Determines what he's feeling motivated. Okay, he's feeling motivated. Determined means according to sentence. Yeah, yeah, again, determined over here. Yeah, determined basically means confirmation also. But in this case, determination, motivation, right? So he is focused, he is ultra sharp, he is focused, he is intense over here. And whatever is determination. So all of you have to be determined to get your OET success. You must invest determination, right? That is determined, is razor sharp focus. So that is the feeling over here, that is the emotion over here, right? So his comments are revealing, his dialogue is revealing that he is so focused, that he is so motivated to start doing sports as quickly as possible, right? So over here he wants to, so he's maybe interested in sports very much, and he wants to starts doing sports as quickly as possible. That means he just had a knee operation. Now see, he just had a knee operation, but he wants to start playing sports today itself. Today itself he had a surgery, but today itself he wants to go and he wants to play sports, and he is determined, he cannot wait, he is determined to do that. So that is the emotion. So just imagine, how will a person speak, how will a spokesperson speak if they are going to start doing sports the day they got their surgery done. So they're going to speak extremely enthusiastic, they're going to speak extremely, eagerly, they'll be very keen. So that is the emotion in which they will speak, if answer option A is the right answer. Right, now let's come to answer option B. So what is the emotion over here? His comments reveal that he is impressed. So it's a very positive information. Okay, a very positive emotion. So he is feeling very much impressed, okay, by how little time he spent in the hospital. Now, why is he impressed over here? Because he spent a very small amount of time in the hospital only. Okay, so usually patients, they have to spend 1 week, 2 weeks, 3 weeks in the hospital, but here he has just spent very little time, and he is very very happy, he's little bit surprised, he's feeling little bit shocked because of that. Right. Mind boggling. Yes, very good. Okay. I'm really glad that you actually noted it. So that is a synonym, right? So mind boggling. So that is an expression of, being impressed. So when a person is basically impressed, they will say mind boggling. So for example, let's say that you have reached your dream country. So your dream country is US, UK, Australia. And as soon as you reach there, the country is fantastic, the climate is very good, okay, the airport is very good, the staffs are very good, the facilities are very good. That means what? You're so impressed, that is your mind just got blown, your mind is boggled. So mind boggling, so it is coming from the audio, so that actually indicates that the person is very impressed. But not only that, you have to link it to this keyword, that is very little time being spent in the hospital. Right. Now, what is answer option C over here? Answer option C is this. He is surprised. Surprise basically means what? He is shocked. Okay, so he is shocked. He cannot believe it. Okay, he is surprised that he will be relatively pain-free so soon. That means he just had a thing over here. Yeah, shocked, right? Surprised over here, right? So pain free so soon. Now why is he feeling surprised? Because the doctor is saying, oh, you will be completely pain free very soon, that is within 2 hours all your pain will go away. So when he gets that information, he's feeling surprised over here. Right, now see, this is how you do the keyword analysis. Right, now let's do the, so all these things are also verbs over here, right? So verbs basically means what? Actions, state. Okay, person's state of being or an action. These are all verbs over here. So here you have to identify what emotion is being revealed by the dialogues of the person. Is the person feeling determined? Is the person feeling impressed? Is the person feeling surprised? Okay, so see, all these three things are three different types of emotions. This is motivation. This is basically extreme happiness. Okay, that is he's, he cannot believe it, and surprise basically means as element of shock over there. And we have three different things. He is determined to start sports as soon as possible. Now see, these three things over here, it indicates a timeline. Now see over here, answer option A, as quickly as possible. Answer option C, pain free so soon. So that means what? So here they're telling rapidly. So here they're indicating a timeline over here. All these three things, all the three answer options over here, they indicate an aspect of time relation. As quickly as possible means what? So soon. Okay, so this also is very, very soon. Very, very soon he wants to say this thing. Now over here, he will be relatively pain free so soon. That also is so soon over here, right? And answer option C, B as well. Okay, that means he is getting discharged so soon. Now see, all the three answer options A, B, and C, it actually reflects a time element over here, and everything is related to, rapidity. Okay, everything is happening in very, very quickly over here, but only one will be the right answer, which means two will be the incorrect answer options. Right. Now you have to register again. You really have to perfect your retention ability. That is, understanding is one skill. So you really have to build in the foundations. Okay. So students usually ask me, sir, like, how can I, from day one itself, how can I get the right answers? Like, how can I understand everything? How can I? It doesn't happen on day one. All right. It doesn't happen. You really have to be very practical over here. And you really have to be very patient with yourself. Build the foundations first. Build the foundations and slowly build up. Right. Now, what you're going to do is you're going to register this information to your memory. Okay. So now you have comprehended the question. Now, what you're going to do, you have to register. Okay. My duty over here, the stem of the question is to identify what emotion is being revealed by the person's dialogue over here. Is the person determined to start sports as quickly as possible, or is the person feeling impressed over here by how little time he spent in the hospital, or is the person very surprised when he hears that he will be? Now see, this is what is the tense over here? Future tense. He will be. Okay, so this is future tense. So again, having that small tense knowledge also is very much important. So this also is future tense, right? What the tense over here? He wants to start doing. Okay, that is, he's not, it has not yet happened. It is going to happen in the future. Okay, the tense over here. But what is the tense in answer option B? Here there's a difference. By how little time he spent. Spent, what is the tense over here? That is past tense, right? So here it is past tense. So only one answer option is basically talking about an event that has already happened, but the other two are basically future oriented. That means it is only going to happen, right? And that clarity will really determine your success rate. Surprise that he will be relatively pain free so soon. Again, not yet happened, going to happen. Okay, and answer option A as well, not yet happened, going to happen. But answer option B, already happened. How little time he spent. Spent basically means what? It is done and dusted, and now he is ready for discharge. So only one is past and other two are future. Right. Now, retention. Now you have, they give you 15 seconds time. So within 15 seconds, you have to read, you have to comprehend, and you have to mentally prepare yourself. You have to identify the question type. Now, what you have to do, you have to listen to the audio. So we listen to the audio twice. So let's just go and read the audio script because for teaching purpose, that is much better. Right. Yeah. So here also there is a contrast marker, but that is not related to the answer. But anyway, for the sake of teaching, I'll give it to you. All right. So over here, now see who's the main speaker. Okay. So we have two speakers over here, right? You hear a surgeon. Okay. Here you hear a surgeon, and you have the patient over here. Now here you need to understand that the main speaker. So in the previous question, the main speaker was the surgeon, but in this question, the patient is the main speaker, because the patient's emotion is what you have to identify. And who's the second speaker over here? The second speaker over here is the surgeon. And the surgeon statements will be a trigger that shapes the answer. Right. So you really have to give importance to the second speaker as well, because the answer is usually shaped by the questions coming from the second speaker. But the main speaker's emotion is what you have to identify. So your attention should be more on to the main speaker over here. Right. Now, again, so you have retained the memory of the question. Okay. Now let's take a look into the audio script. So the surgeon is asking you. So second speaker is speaking first. How are you feeling, Mr. Shaw? So see, feeling. Okay, that's exactly what we want, right? So see, as I told you, the second speaker over here will shape the conversation. So the person is asking you, how are you feeling? And that is exactly what we want. We want to know how the person is feeling, right? Now the person is saying over here, exhausted, but the painkillers must be working. Now see, are you able to identify the, again, this is not related to the answer over here, but are you able to bring in the contrast marker? Now see, exhausted, what is exhausted? That is a negative information. I'm feeling so tired, I'm feeling very exhausted. That is a negative emotion, right? Now a contrast marker is coming, so that means what? From negative, a positive information is going to come. So what's the positive information over here? The painkillers must be working. So even though the patient is feeling tired, okay, the patient is saying a positive information. Okay, okay, even though I'm feeling very tired, I believe the painkillers must be working. Now see, contrasting information is coming, and that signal, so the word but over here, it signals that sudden change. That is why we call this as a contrast marker. Right. Now the person is saying, I cannot feel my knee as you predicted. Now see over here, the person is saying he cannot feel any sensation in his knee over here. Right. So again, all these things are not all related to the answer options. So let's just keep, listening to the audio over here. So now the surgeon over here, okay, the second speaker over here saying, you are bound. Okay, you're bound basically means what? It is inevitable. Inevitable means, yeah, it will happen. This is normal. You're bound to feel weary. The same thing. Okay, so these are all synonyms over here. Exhausted and weary. So those who are a little bit weak in vocabulary understand weary basically means exhausted, right? So the person is saying, you're okay, it is okay to feel exhausted. Okay, it is normal. You're bound to feel weary after an operation. Okay, it went well though. Okay, now see over here, what is though? As I told you, this also is a contrast marker, right? It went well though over here. Now see, you're bound to feel weary after an operation. What is that? That is a negative emotion. Okay, that's a negative statement, right? But this, what is this information over here? It went well. It went well basically means what? It is positive. And see the word though, although. Okay, so that is also like, just like but, that also is a contrast marker. Now see, a sudden, like that shift in change is being reflected over here again. So you really have, if you really understand contrast markers, it is really going to help you out in both reading as well as listening. Right. Now let's just keep reading over here. We cleaned out loose cartilage, okay, from the joint. You can go home now. Okay, now see, you can go home now. What does that mean? That means the operation is over. The patient is feeling very tired. The patient is not having any sensation in the patient's knee. Okay, and they have cleaned, and they're giving an explanation. They're giving an explanation why the patient is feeling this tired and all, what happened. Okay, this is all distracting information. But over here, the surgeon is saying you can go home now. That means what? That means it is time to leave the hospital. You can go home basically means what? It is time to leave the hospital. Right. So your eyesight, okay, your eyesight should come to answer option B, because now they're talking about leaving the hospital. Right. How little time he spent in the hospital. Right. Now let's see. So your eyesight. So your eyesight is an answer option B, but we have not yet chosen answer option B. We have to determine whether impress is mentioned over there. Okay, all these things are impressing the main speaker. So we have not yet come across them. But your eyesight is an answer option B, because they're talking about discharge. Now see over here, oh thanks. So the person is saying, oh thank you. So he's feeling happy, right? So when a person is happy, they will say thank you. Oh well, thank you. And the person is saying, I had. Now see, this is past tense. I had an arthroscopy on the other knee several years ago. So many years ago, the patient had an arthroscopy and the things. Now the person is saying, so I know what it's like. Okay, and that is, they're talking. So what is the word it over here? Okay, so again, I'm just giving some small information. Loose cartilage from the joint. Okay, so this is what this word it is referring to. Okay, so the surgeon is taking, okay, we removed loose cartilage from the joint. So the person is saying, oh, thank you. And the person is saying the same thing. So he is saying, I had the same procedure previously done. That is several years ago. Several years ago, I had an arthroscopy. Okay, so I know what it's like. That means I know exactly how these kind of procedures feel like. Now the person is saying the idea that it gets done in less than a day. Now the person is saying that it gets done. Now see, what is the word it referring to? It over once again is referring to this particular information. Now see, this is you should be able to make the right connection. The person is saying the idea that removing loose cartilage from the joint. So he had the same thing several years ago, but now he is saying the idea that it gets done in less than a day. Okay, that is less than a day is still pretty mind-boggling though. Right now the person is expressing, now see what emotion is being revealed over here. Okay, he is saying I am so impressed, I had the same thing done to me several years back. Okay, but now due to medical advancements, okay, removing these kind, cartilage from the joint, these kind of procedures, in less than a day it is done. Okay, and I'm basically able to go home now. That is something that is very much impressive to me. Okay, I'm very much impressed. So he's saying my mind cannot comprehend it. It's still pretty mind boggling over here. Now see over here the timeline. Okay, so impressed, pretty mind boggling. What does that mean? That indicates the person is very much impressed. All right, impressed over here. And why is he impressed? He is impressed because this entire operation, this entire thing that was done in the hospital, it gets done so soon, in less than a day. He's so soon, and now the procedure is done, the hospital purpose is done. Now he is basically ready to go home, right? So this is the reason why he is impressed over here, right? So now your eyesight. Okay, so we are still in so we came to answer option B, right? And now we can say answer option B is probably going to be the right answer because all the keywords impress is mentioned. Okay, how little time he spent in the hospital, again past tense over here, everything is mentioned, and the patient is ready for discharge over here. So the keyword is mentioned, the verb is mentioned, and it is very much related to the question, the stem of the question over here. And again, we have not yet eliminated answer option A or C, so we can say that answer option B is most likely to be the right answer. Right. Now let's come to the remaining part. Okay, so again, so you're still in answer option B. Now let's come to the remaining things over here. Now the surgeon is saying you will need crutches for 2 weeks. Now, see, this is a negative emotion, right? You will need crutches. That is for the next 2 weeks, you still have to use crutches. Now, see, the contrast marker is coming. Contrast marker basically means what? A sudden shift in change or idea. But you should be walking okay within a month. Now, see, this is a negative emotion. You will need crutches for 2 weeks. What is that? That is a negative statement, right? That means you are not healthy. For the next 2 weeks, you have to be very careful. Okay, so that is a negative statement. But immediately a very positive information is coming. You will be walking okay within a month. Okay, now that is a positive information, right? And see, in the same sentence, two contrasting information is coming, and usually it is done by using a contrast marker. And but is usually the most contrasting. Again, so it's not related to the answer, but the previous question we talked about contrast markers, right? So I'm just giving you the idea once again over here. Right. So the person is saying you will need crutches for the next 2 weeks, but you should be okay, walking okay within a month. Give it, now the person is saying give it 4 months before you put any serious impact on it though. It basically means what? The knee over here. Now, what is answer option C? Now, see, what is answer option C telling? The answer option C is telling that this person over here is going to be relatively pain free so soon, right? But what is the audio telling us? The audio is telling that the person is not going to be pain free so soon. The audio is telling that he is not going to be pain free so soon. That means the audio is telling he has to wait. He has to wait for minimum 4 months, right? See, the surgeon is saying, okay, you need crutches for 2 weeks, and within a month you will be walking. Okay, but still you have to wait for 4 months before you can put any serious impact on it. So what is answer option C? Is it agreeing to answer option C? No, right? It is basically the opposite. That is, he is not going to be pain free so soon. He needs to wait at least for 4 months. So we can say that this is not going to be the right answer. Right. So that is done. And again, the feeling of surprise. So since this is not mentioned, so if this is not mentioned, it does not matter if this is mentioned or not. Even if surprise is mentioned also, if this is not mentioned, we cannot choose answer option C. So we have eliminated C option and we highly suspect that B could be the right answer. Right. Now, anyway, let's come to answer option A. Now see here, he is determined to start doing sport as quickly as possible. All right, so let's see whether they are covering that information as well. Now see, the person over here is saying he's asking for 4 months. Now he is asking, he's saying after my last operation. What was the last operation? The last operation was this arthroscopy. Now see, they're talking about this is the last operation, right? So what is the person saying over here? The person is saying after my last operation, I started running again within a month. Now see, this is past tense. I started running again. So this is past tense over here. I started running, right? Past tense. But this again started running again in a month. But over here they're telling started doing sport as quickly as possible. So I already told you that this is not past tense. This is what? This is future tense. Right? So here they're not talking about this surgery. Here they're talking about in the audio, they're talking about a previous surgery. But here the person is saying right now he is determined to start doing sport as quickly as possible. That is in the future. He just cannot wait and he just wants to start doing it. Okay, again, that is future tense over here. But this is over here past tense. Now the person is saying, thinking, no, see, this is something that he did previously. So previously he had a, so listen to me very carefully over here because I'm going to help you eliminate answer option A. So previously he had an arthroscopy. Okay. And what did he do? He started running again. So the doctors may have told him, you just had an arthroscopy, so you have to be very patient. But he is not patient. He started running again within a month. So within a month itself, he started running again. Again, this is past tense over here. Now the person is saying thinking about it. Now the person is saying thinking about it. It basically means what? What is the word it over referring to? It over here is referring to this particular information, running within a month. So he's saying, okay, now I'm thinking about it. Okay, now I'm thinking, why did I start running immediately? So he's saying, I guess I paid for it. Okay, see, for example, I paid for it. So this is a figurative speech. Okay, this is a figurative speech of it means he paid the consequences. Okay, so we'll say you have to pay the repercussions we say, or he had to face the consequences. So this is what he is saying over here. So he is saying, previously I had this operation and I did not wait. Within 1 month, I started running. And now I'm thinking about it. I'm thinking about it. But now I paid for it. Now see, he's saying I really had to face some serious consequences. So that is the meaning of paid over here, not money over here. He paid for us, impatience over here. Now see the pain, the knee had a lot of niggles, had a littles for months afterwards. So because he started running immediately, okay, he had to face the repercussions, that he had to face the consequences. And he is saying, because of my foolishness, I have my knee over there, it had a lot of problems after that. Okay, so now what do you understand? So now see, here, what is answer option A? Answer option A is telling he is determined to start doing sports as quickly as possible. So, listening to that last section, do you think that he is ready to start doing sports immediately? That is just like previously. Previously, he had an arthroscopy, and without wasting any time, he started running. Okay, and but he's accepting it. He's accepting that that was a foolish idea, and because of my impatience, I had to suffer a lot. Right. But now, why is he saying this? So he's saying this time I had a new surgery recently, but this time I'm not going to repeat that same mistake. Now he's saying, so he's indirectly saying, I'm not going to start doing sports as quickly as possible. That means he's not at all determined to start doing sports because he does not want to pay the repercussions. He does not want to face the consequences. So what does that mean? So the comments reveal over here, okay, so the person's comments reveal over here that he is not determined, he is not at all determined to start doing sports as quickly as possible, because previously, because of his foolishness, he paid a lot of consequences, he had to face a lot of consequences. So this time he's saying, I learned my lesson, I learned my lesson, so this time I'm not going to do this immediately. So it is the exact opposite, which means you can eliminate answer option A. So this is what we call as an extreme contradiction. It is the extreme contradiction of what is mentioned in the audio. So because in an extreme contradiction, we can say that answer option A is eliminated. And we have also eliminated answer option B, answer option C, right? He is going to be pain-free so soon. So here that link, you have to wait for at least 4 months. So none of these things are mentioned. So if A and C, if you have eliminated, then automatically what will happen? Answer option B is the right answer. And is that mentioned? Impressed, mind boggling, that is mentioned, right? So that is definitely mentioned over here. And how about this? Why is he impressed? By very little time he spent in the hospital. That is, in less than a day the procedure got completed and is now ready for discharge. So that is the reason why he's feeling very much impressed. So answer option B is the right answer, right? So again, there is actually a document that I had prepared. I actually forgot to show you the document. So again, the 30th question over here, right? So this is the 30th question. So the 30th question over here is basically identifying the speaker's attitude over here. Okay, speaker's attitude. So again, I have given you emotional reactions. Okay, so you can just go through this document. I'm not having too much time to discuss this. So all the exam day strategies for this particular question, along with that, a vocabulary list. Okay, say niggles, mind-boggling. What does it mean? So all these kind of things, and synonyms, so that you can improve your synonym recognition skills, has been mentioned over here, right? So answer option B over here becomes the right answer. So now what I'm going to do is I'm going to show you the question once again, and I'll play you the audio, and this time you see whether you're able to understand why B is the right answer more thoroughly and why answer option A and C is wrong. Yeah. So now let's hear the audio script.
How are you feeling, Mr. Shaw?
Oh, exhausted. But the painkillers must be working. I can't feel my knee as you predicted.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Huh, thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month.
Good.
Give it 4 months before you put any serious impact on it, though.
4 months. After my last stop, I started running again within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
All right. So, all right. So that clarifies the 30th question as well. All right. So let's just have, a small recap of what we discussed. So in today's session, we discussed 2 questions, and both those questions were basically what? Speaker's emotional focus. That is, when you're listening to the audio, you are basically identifying what emotion they are revealing, right? What feelings they are expressing through the words. That is, what they are saying and how they are saying is extremely important. Okay, that is why it is called as speaker's emotion focused type questions. So when it comes to strategies, okay, mentally prepare yourself, comprehension, retention, detection, listening to the audio, listen for emotional language, okay, words that expresses emotions. Pay very close attention to the tone. Okay, so from the tone itself, you must be able to understand the emotion over here. Urgent, please, frustrated, so and so. And the OET will always try to trick you. So don't fall for those kind of tricks. So don't be too innocent over here. All right. So you have to what you need to do. You should be very careful so that you don't fall, victims into all these kind of things. So avoid the distracting information and, refine your elimination strategies. Okay. You should be able to eliminate the incorrect answer options thoroughly. Right. So that is what we discussed in today's session. So